What's your last name?
Davis.
Davis. Oh, it's just that our media affairs people want to know who I talk
Okay.
to.
Okay, so let's talk vaccinations. Where do you think we are in vaccinations? Do you think we are where we need to be?
um, are you speaking from a state perspective or from a regional perspective?
We can talk broad first and then narrow it
Okay.
down to state. So,
Well, the state has really done a tremendous effort to get vaccines in here, to get them widely distributed, and to get the population vaccinated. And so, you know, um, this has been a gargantuan effort. But what's happened is they call it the law of diminishing returns. The first part of that curve is very easy because those are the people who wanted to be vaccinated badly. And so they would cross parish lines, they would go out of state, they would, do anything they could to get vaccinated. And that was largely older people. And so those folks have been vaccinated. And that's people who came in to drive, these drive-throughs and mass vaccination efforts that have been very successful. But what has happened is the people that are in the 60 to 70 and above age group are also the people who are most likely to die. And 7,000 out of the 10,000 deaths in Louisiana are in that age group. And so that age group recognized the danger and came in and got vaccinated. So we have 60 to 70% of those people vaccinated. But as you decrease in age, you're getting people who can still transmit the disease, but are not so personally concerned. And you get down in children who also can transmit the disease, but are likely not to get particularly sick. And those convincing that group of people is getting tougher and tougher. And that's the top part of this curve where you have to furnish more and more effort to reach fewer and fewer people. And that's why it's kind of stalling out.
because here in Region 7, we have a lot of low percentages in certain neighborhoods of people not wanting to get the vaccine.
Absolutely. Well, we see that too. So your region actually has done a little bit better than ours. We're only about 21% vaccinated. And of course, when you talk about herd immunity and so forth, you're talking about figures of 60 and 70%. And so in Shreveport, you in the Shreveport area, you can do exactly the same things you can do in Alexandria, and you can actually go down to the census tract level, and you can see those census tracts where there is lower percentages of vaccination. And that differentiation is largely socioeconomic. And so these are also areas that we call social vulnerability areas. And in our region, it's largely Black populations. We have very few Hispanics, and there's a huge divide between the percentage populations between African Americans and whites, largely based on income differentiation.
And so, do you think that plays a role in why we have such a great divide in people wanting to take the vaccine?
Well, there's actually two things. There was a lot of initial resistance in the Black community because of historical reasons and sign of a suspicion of white medical care. I mean, I'm trying to be delicate about this, but there's no delicate way of putting it. There's a certain level of suspicion, and so that will always play a role. But it seems like the message is getting through to at least the African American community that this is a good thing. It will impact and benefit their communities, and so. And then you have this other group that is largely made up of poorly educated white rural people. And those folks, there's a lot of resistance in that population, based on personal beliefs, political beliefs, whatever. And much of the resistance is actually based on fear. It's fear of government intrusion in their lives, fear of microchips, fear of sterility, fear of impotence. I mean, there's a lot of fear that's involved in that, and it's very, very difficult to combat fear, because it's not a intellectual problem, it's a visceral problem. And that's why we're running into this kind of stall out effect.
And so, how do we reach these people to get them to get the vaccine?
Well, you have different kinds, in the African American communities, what we're doing is we're doing this Bring Back Louisiana, which is actually going door to door with people from the community. And the people from the community are the most likely trusted messengers. So in that community, it's finding people that are likely to be look like the people in the community, have their same experiences and be able to communicate effectively. So that is we're doing. The other population of that's more rural white population is extremely difficult because you need to have people that are that also look like them, talk like them, act like them, and you can't use the same messaging. So for people that are worried about government intrusion and government control and lots of other issues, you have to convince them that this is actually in their best interest, that they have all the control. So it's a control issue, but they have the control to take the vaccine or not take the vaccine. And it's in their best interest. It's not necessarily in the community's best interest, which it is, but it's in their personal best interest. And so the messaging is actually different for different groups of people who are resistant. So I don't know if that answers your question.
Yes, it does. So, because yesterday the governor spoke and he was saying that we have people vaccinated, but we're just not where we need to be in Louisiana. Do
Right.
you agree with that statement?
Oh, absolutely. And I think it's a larger health problem because Louisiana is essentially a poor state, and it has, a large segment of the population that is poorly educated. And our outcomes in the United States in general are now 50 out of 50. So it's a broader problem related to poverty and educational issues that are very, very long standing. And that's why we tend to stall out when we get to certain public health measures.
And so we still have a long way to go.
Ooh, we got a long way to go. So I don't, it's not hopeless. And people are working very hard on this, and people of very goodwill are doing a lot. And, but, the best thing you can do is, as a young person, is that you can work with your age group and you can convince them, because I'm a terrible messenger for young black people because I'm an old white guy, and that's just like, so you get people that look like you, that act like you, that talk like you, and that are convinced appropriately that this is important, and then you commit, and that is going to be your most effective message.
And so, as a state, are we still getting in more vaccine than we're passing out, basically?
Yes. I mean, the answer is yes. So this is a kind of a drama because you're going to end up with significant quantities of unused vaccine that will expire, and that is a terrible dilemma, especially when you consider the worldwide situation where there are countries that actually have none. So this is a very serious concern at all levels of our government.
And is there anything else that you'd like to add?
If you haven't been vaccinated, you should get vaccinated. In Central Louisiana, we do it in every single parish. We do it if through a drive-through. We go to churches. We go to food banks. We go to farms and migrant workers, and we're making this as easy as we possibly can. But we cannot reach those goals without public support. So now it's up to the public. And since they've dropped the levels down, bring your kids in 12 years and above and get them vaccinated.
And will you start by saying your first and last name and your title, just so I have that correct?
I'm Dr. David Holcombe, Holcombe. and I'm the regional administrator slash medical director for the Office of Public Health for Region 6, which is Central Louisiana.
All right. Well, you're right next door.
Yes, we are. Well, we
Well,
share, you surely Dr. White, you know, so she's going to say all the same things I did, maybe without less hand gestures.
no, you did well. Thank you so much for your help today.
All right. Well, thank you. And I'll tell them that I talked to you and hopefully I didn't say anything that they won't find acceptable.
No, you did great. Okay. Bye bye.
All right. Thank you.